hand on chest, pull down. The cartilage of the rib cage. You find from the center, tissue pull out. Find the joint of the cartilage where the cartilage meets the sternum. Then your tissue pull comes off a ½ inch past that. Your goal is to stretch and release the adhesion. Breath in and hold your breath. Hold the breath. Roll out the slack. Bend over, set, blow out. Roll out the slack, bend over, and set. See how I hinge from my hip so my shoulder is over my wrist with my elbow bent. I do not want to do this. That would be bad. No CPR. We're coming this way. Chondrocostal. You tissue pull out. Find the joint. Tissue pull to the bone. Breath in. Hold breath, roll out the slack, set, blow out, and set again. My elbow can come a little higher because the rib is rolling away. Okay? SC joint, if the sternoclavicular joint is superior and medial, I stand on my superior leg, take a contact onto the clavicle, and adjusting in what direction? Just below the coracoid process. Breath in, breath out, wait, 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 load, set, release. Under the coracoid. If the SC joint is medial and inferior, I lift my knee under the scapula, so this scapula here is relatively flat. So there's less rollout on the body. Again, hold, find the middle trapezius, hook, tell the patient I'm not going to choke you. Breath in, breath out, load, and set. Okay, make sure it's shallow thrust because I don't want you to hurt the first rib underneath. A lateral, hook your fingers on the scapula, come in underneath the clavicle right here. Breath in, breath out, bring it up, and set this way through the joint line. Drop piece would help. Okay? Lie on your side facing away from me. Scapula mobilization. Bring the scapula up toward the ear. Aim to a spot 3 inches behind the EOP and impulse. Breath in, breath out, up, circle back, impulse to release the scapula off the rib cage. Feel the hand under the clavicle. Go out, grab onto the lateral border of the scapula here. See where I'm grabbing? Breath in, breath out, bring it straight back, and peel the clavicle off the apex of the rib cage. Now the scouring, this is for swimming, for backswing in tennis or golf. Heel of hand on the lateral border. You're taking the acromion and the spine here, bring it down, rotate it into the spine, and impulse and scour 3 or 4 times to recover this motion low, middle, high. And that releases the scapula off the rib cage. Sitting up to the end of the table, scooting up right there, face scooting back. Clavicle, superior clavicle at the AC joint. Take my fleshy pisiform, contact, grab the back of my arm, my shoulder, raise your arm up, externally rotate, grab the back of my arm. There you go. So this hand is on the lateral border of the scapula, not on the humerus. I load into the distal clavicle. I load in, lift up, and set through. Now I don't want to dislocate the shoulder, that would be bad. See where I'm stepped forward into scaption? I don't want to hyperextend and come up and dislocate the shoulder. The arm's in scaption, elbow lower than the joint, load in, and set. Okay? Okay, you guys can come around this way. The AI shoulder, or an anterior. Make sure where the spine of the scapula, right here, is right on your sternum. So I can't be standing behind my patient I have to be where?
Off to the side.
Off to the side. And I bow, bring the arm up, down, bring the elbow in as I externally rotate, find my contact, keep it externally rotated, and I impulse for anterior or anterior-inferior. See how the scapula is stable. Do not go underneath and lift like this. That's an automatic fail for the class, and I'll see you next quarter. Okay, standing right here, facing me, left hand. So we have a posteromedial ulna, a valgus subluxation. Take your end of your base of your index finger, nail point 8, right here, under the medial epicondyle, right on the ulna. Extend, traction, set. My body is angled forward, my core is engaged down, so I'm stable, so I can take a quick flick from the pelvis. Traction, quick. No big throws from the triceps. Same thing for a varosubluxation. Get your body angled down, shoulder over your adjustment, traction, and set. Now, if the forearm is not fully supinated, I can't get a contact. And I might hyperextend and injure the elbow. So for safety, what do you have to do with the forearm? Yeah, all the way supinate before you do the adjustment. Okay, anterior radius, kneel down, elbow on table, find the radius, load the joint, and then turn into your palm and set with a drop piece. Standing up, facing away. 2 fingers, lateral epicondyle, knob of the radius, neck of the radius. See how far down I am from the lateral epicondyle. Take your thumb into the notch. 2/3 of the way supinate your forearm. Open your palm. Okay, turn, supinate. Supinate all the way. Pronate all the way. Now just go 2/3 of the way. Start with pronation, stay. Supinate slowly. And when it starts to turn, you set. Repeat. Again. One more time. And again. Kneel down facing me. Positive phalanx. Elbow on the table. Watch the fingers so you don't break them. So we have diminished wrist flexion. Proximal carpal row needs to glide posteriorly. You distract the radius from the proximal carpal row. You flex it over the ball so you find where it restricts. So you distract it first and keep it open as you fulcrum over. And when you find the restriction, then you set here. Distract, fulcrum, set. So if you don't have a reverse phalanx, you do the same thing. Distract, fulcrum over the ball, and set the distal radius A to P. Okay, Dr. Hickey and I will tell you which 3 we want you to do. We want you to have a good experience, but you have to know at least these. Okay? Bye.